So once again, good evening. Welcome to our session on varicose veins and ThermaVein treatment. My name is Vicky and I'm hosting this session. I'm delighted to be joined by our expert speakers, Mr. Aaron Sweeney, consultant vascular surgeon, and Dr. George Taggart, private GP and thread vein specialist. Tonight's session will begin with a presentation from Mr. Sweeney and Dr. Taggart, followed by a live Q&A session. If you have questions at any point, please do feel free to submit them using the Q&A icon at the bottom of your screen. You are welcome to ask anonymously or include your name, but just a quick note that as the session is being recorded, any names shared may be visible in the recording. And to help us get through as many questions as possible, we'd ask that you please keep your questions as brief as possible. If you're interested in booking a consultation, we'll share all the relevant contact details at the end of the session. So I'm just going to hand over to Mr. Sweeney to present.
Hello, thanks very much for joining us. This is just a little picture of myself and a little bit about me. So I qualified quite a while ago over in Dublin and came here a couple of years after that. And I was appointed a surgeon up in central London in 2002. My main interest has always been varicose veins. Even as a junior doctor, I was there when they first started lasering veins up at University College London, which I think was around 2000. And I, along with my old friend and colleague Eddie Challoner, brought it to the NHS in London. And we did thousands and thousands when we were able to on the NHS for many years. I've been here at Benenden for over a decade now, and we perform somewhere in the region of 1,000 veins here per year, which means we're pretty high output unit. I think we do the largest number of laser vein treatments in the country and have done that for a decade or so. So hopefully you can be reassured that we know what we're doing.
Good evening. My name's George Taggart. I qualified in medicine in 1991 at St Thomas's Hospital in London. Qualified as a GP in 1997 and have been a GP partner in the NHS in East Sussex since 1999. I developed a special interest in the treatment of thread veins back in 2017, about 10 years ago, and have been working in that field ever since. And I joined Mr. Sweeney here at Benenden 2 years ago.
So we're going to just run through the various things that are available. I was going to talk a smidgen about varicose veins and just give you an idea of what they are and what happens if you want a consult, what treatments are available. I'm going to also talk about smaller cosmetic thread veins and just the various treatments that are pretty effective and available. The real good part of this webinar is the Q&A session at the end, because I think a lot of people already know what they want to ask, and we encourage that because it often brings on new questions and things you never thought about are often asked, and it gives you a decent bit of information. So just to let you know that here at Benenden, they've got a CQC rating of outstanding, which is pretty exceptional. Just means that it's a clean, nice environment where people do things correctly. So what are varicose veins? Well, I think most of us have seen big chunky things on people's legs and or swollen or sore legs, or remember their granny or their mother having loads of grief from varicose veins. If I tell you that they're often visible, but sometimes they're not. And if you want to think of what veins are, you have an artery that brings blood down your leg, and then you have a vein that takes it back up again. The main vein that does that is called your deep vein. It's a big thing, about the size of your thumb. And if you were doing exercise, it can easily drain a litre of blood per minute. I think it's helpful to think of veins like a Christmas tree. You've got a very large central trunk, and then you've got branches going in. Those bigger branches are nearly always draining muscle, so they have a little bit of muscle on the outside squeezing the blood and getting it going uphill. And then you have loads of little small veins, which are draining the skin. There are hundreds and hundreds of these. They're normally less than the size of a shoelace, normally draining maybe a teaspoon of blood per minute. And perhaps a million years ago, when we were walking on all fours, they were draining happily. But because we've decided to stand upright, they're going straight up, they're vertical, they're not surrounded by any muscle, and they rely on little flimsy valves to keep everything going in the right direction. So if they don't work properly, you sometimes end up with swelling, cramp, blue or large veins visible, but often the skin gets a bit of a rough time because it's trying to drain old blood. The veins are trying to go uphill, and if any valves have failed to work, it often pools just onto the skin, and that's why your skin can become dry and itchy, and also the reason why you can develop thread veins and chunky varicose veins. There are all quite a few different types of veins. If you think of that Christmas tree analogy, there's the smaller veins, which are rather like the pines of the Christmas tree. They can be quite itchy and sore, and Dr. Taggart does a wonderful job getting rid of those. Sometimes they're slightly larger where you can feel them. We call those grade 2. Again, they can be treated well, and usually with sclerotherapy. 3 is kind of where I come in and start doing some laser treatment to get rid of veins like this. Often the ones you see on the top, the veins you actually can see are not the real story. So the reason when you come to me that I do duplex ultrasound and scan your deeper veins and everything under the skin is so that I can see exactly where they're all coming from. They get a bit more medically important when you start getting itchy or sore skin, and particularly if your skin changes color. And then the worst case scenario is where your skin really is not happy at all, and it can sometimes blister, or occasionally you can develop an ulcer. They're called grade 5 and 6, bit grim. You don't need to spend too long on that. So when you come and see me, it's me, you see, and I do a scan in clinic with you. I normally do a few diagrams for you, which you can take home, just to try and explain exactly what's going on and what options are available to you. Surgery is as a day case. You usually walk in, walk out. Many people have it under local anesthetic. Other people have things under a general anesthetic. I think it's entirely up to you how you choose to have that. That's the most important thing about the consultation, is that it's you who decide what you have done. So previously, you might have heard of people having stripping as a vein operation. Seemed pretty decent idea. You did a cut on usually the groin, and you disconnected everything, and you put a wire thing down the vein called a stripper. And that worked pretty well, but a bit brutal, and it had a pretty high recurrence rate. So people have tried to do what we call minimally invasive treatment, which essentially is threading something up the inside of the vein. With a laser, you're trying to damage the inside lining of the source of all your varicose veins, and it works pretty well, not quite pain-free, a bit like having a dental appointment. And if you have it under local anesthetic, there's a little bit of discomfort from needle jabs, but it works pretty well in that most people afterwards will be up and walking around and certainly walk out of the hospital, but it does feel a bit achy. This is the inside of the right thigh, and the vein that normally causes trouble runs down the inside of your leg. Usually you can't see it, but branches of that vein normally pop up just around the knee or just below the calf. And so normally that's the vein we stick the laser up. Laser is just a fancy way of burning things. It's a little tiny wire. It's not like a James Bond movie where you're zapping from outside. It's actually in the inside of the vein. I zap the inside lining of your vein, which is very, very fragile. And when you zap it or burn it, it shrivels up quite quickly, and that kind of turns the tap off. It stops the backflow going down your leg and deflates all the veins below. It's a little idea of what's going on there. So there are many different types of treatment. I happen to use a laser, but there are many other treatments where you thread something up the inside of the vein to damage the inside lining, and sometimes you use electricity, sometimes microwaves. They all work pretty well. Occasionally we use a chemical to inject a type of foam up the inside of a vein. That again works pretty well. I think it works very well for smaller veins. I don't use it normally on larger veins. But the main thing is that there are lots of different treatments. If you look on a website the government funds called NICE, that gives you an idea of what's the best technique for treating something like varicose veins, or indeed any treatment. And it says that heat treatment is the best first-line treatment for varicose veins, and that would include lasers or microwaves. So this is the inside of someone's left leg. So on the left side, you can see a few veins popping out. They're actually coming from a vein running under the surface right from the groin. If we just laser, you'll see a few weeks later, it tends to deflate. Doesn't quite go completely. 6 weeks later, it's almost gone, but you can still see a few little bits. Occasionally, at the same time as lasering, I will do a few small incisions called phlebectomies, just to speed this process up and make sure it's cosmetically acceptable for you. The most important thing about lasering is it is an operation. So sometimes people read that it's pain-free, that it's you can get back to being completely normal the next day. I would say that for most people, it's relatively okay, but they usually take a painkiller. They nearly always feel like they've done a bit too much exercise, or, for example, the day after the first football match of the year, that kind of pulled muscle ache type sensation. In general, they take something like ibuprofen or paracetamol as a painkiller. And although you could technically work the next day, most people take it easy. And you can certainly walk the dog the next day, but you wouldn't be doing a 5-mile walk. I think most people take it easy. Normally it takes a few weeks to get back to full speed, back in the gym, playing golf, etc. And it often takes about 3 weeks before people go back swimming, for example, because it does look a little bruised and it's a bit obvious for the first few weeks post-surgery.
So we've heard from Mr. Sweeney about the treatment of larger varicose veins, but at the other end of the scale, as already mentioned, are the small grade 1 or thread veins, which typically occur on the face and legs. Thread veins generally do not cause any physical symptoms. However, for many patients, they can cause significant cosmetic concerns and problems with self-confidence. Here at Benenden, we use well-established, safe and effective methods for the treatment of these tiny veins. So for treatment of thread veins on the legs, we use a technique called microsclerotherapy. It's a sort of mini version of what Mr. Sweeney is doing. It involves the injection of a liquid or sclerosant into the vein. And we either use a concentrated saline solution or a chemical-based sclerosant. Upon injection into the thread vein, these liquids cause a reaction to the lining of the vein, which leads to clot formation, fibrosis or scarring, and eventual closing down of the vein. Once the vein is closed down and empty of blood, it becomes redundant and is eventually reabsorbed into the surrounding tissues. It then is no longer visible. An appointment for microsclerotherapy would consist of an initial consultation, including careful examination and explanation of proposed treatment. Subsequent appointments for treatment last 30 minutes. During an appointment, multiple injections will be performed, depending obviously on the number of veins requiring treatment. Small dressings are applied to each injection site, and these need to be kept dry and in place for 3 days. It's an outpatient procedure, and normal activities can be resumed immediately after the appointment. Typically, patients would require a course of treatment, and subsequent appointments are 1 month apart. For the treatment of facial thread veins, we use a technology called ThermaVein. Now, this technology has been was established in the late 90s and has been extensively and successfully used in vascular clinics ever since. At Benenden, we're using the most up-to-date version of the technology currently available. Attached to the ThermaVein machine via a wire is a tiny nickel probe, which I'm pointing to on the screen. The probe is insulated along its length. And this insulation ensures that all the energy from the machine can only exit the probe at its very tip, which has a tiny surface area, about the width of a human hair. This allows low energy from the machine to be used and delivered very accurately, which minimizes the potential for side effects. Using the probe, we apply very light pressure to the surface of the skin overlying a thread vein, and this blanches the vein at that point. Then we apply a short burst of energy from the machine with pinpoint accuracy. This heats the wall of the vein, causing it to collapse and stick together at that point. The probe is then moved along 1 or 2 millimeters, and the process is repeated, sealing the vein as we go along. The vein is now shut down and empty of blood and is no longer visible. As with microsclerotherapy treatment, redundant and empty veins are eventually reabsorbed into the surrounding tissue and are no longer visible. The best way to understand the process is to see it in action, and I have a video of a patient I recently treated. She's very kindly given her consent for us to watch the treatment in action. As you can see, light pressure is applied to the skin, and then the machine delivers the burst of energy, sealing the vein. And we can see before and after images. This is a small this is a small hemangioma, or a blood vessel near the surface of the skin that's disappeared on the treatment. And again, a prominent thread vein on a cheek. Disappearing after the treatment. One more. ThermaVein is an excellent treatment for red and purple thread veins on the face, vascular blemishes anywhere on the body, and it can also be used as an adjunct to microsclerotherapy on the legs for veins that are too small to inject. Due to the heat energy we are applying to the skin, an inflammatory reaction often or usually follows treatment, and this can make the treated area red and slightly puffy. On this picture, we can see prominent thread veins on the nose that have been treated, leaving quite an inflammatory reaction afterwards. This usually settles within 2 to 3 days, but it can occasionally last up to a week, or very rarely even longer. Immediately after treatment, we apply aloe vera gel to the skin, and this soothes the skin, and we recommend you continue this until the inflammation settles. Most patients require a course of treatment. The number of treatments depends on the extent of the thread veins. And this, along with any other aggravating skin conditions such as rosacea, are assessed and discussed at the initial consultation. If rosacea is present, I would often prescribe a treatment for that to prepare the skin for ThermaVein treatment, as results are better in this way. As with leg treatments, subsequent appointments are 1 month apart, and this allows the patient to fully assess the results and the need for more treatment. Here we have some more typical nasal thread veins before and after treatment. In summary, thread veins are a very common problem and can be debilitating. In microsclerotherapy and ThermaVein, we have well-established, safe and effective techniques for their treatment.
Thank you both very much. It's now time to move on to our Q&A session. So we've got a few questions already, so please do feel free to ask. First question is from Laura, and Laura says, can you have laser and foam treatment at the same appointment?
You can. Normally, I would laser the vein first, and if the foam would be a very small amount, because often just by lasering the main vein, everything deflates quite a lot. So it really depends on how many veins you have and exactly where they are. But the simple answer is yes, you can have both done at the same time.
That's great. Hopefully that was helpful, Laura. Next question is it safe to have varicose vein treatment while taking statins?
Again, that's fine. In fact, you can take everything. Some people are on blood thinners such as apixaban or rivaroxaban or warfarin, and I'm happy to treat their veins whilst they're on those types of drugs. There's virtually nothing I can think of from a medication point of view that would stop you having your veins treated.
Okay, lovely, thank you. Next question. Is there a benefit to waiting until my veins get worse in a year or two before to avoid multiple treatments?
And that answer is, it depends. So if you are worried that having a vein operation is somehow going to mean that for the rest of your life you're having your veins fixed every few years, well, because we don't really strip them anymore, normally I only see people once to have their veins treated with a laser, so I see no point in waiting. Other people, though, most people who come to me for varicose vein treatments have had them for about 10 years. They're nearly always of an age where they've had kids, etc., and basically have been taking care of other people. So it often takes about 10 years to get to see me. And then when you finally come, I don't see much point in waiting. Occasionally, if you're planning on getting pregnant, I would suggest perhaps it's not wise to have them done just before pregnancy, or if you're trying. But sometimes people say, oh, I was told that I should have all my babies first before ever having my veins treated. I think that's a rather old opinion, and it's to do with stripping. So varicose veins can be quite unpleasant during pregnancies because your hormone progesterone rises quite a lot, and that dilates varicose veins and makes them a bit miserable. So I would normally say, if you've got a varicose vein, if it's given you a bit of grief, I would have it done, treated. If, however, it's not causing you any trouble, there's no particular urgency about having them treated. You certainly shouldn't feel pressurized into having something done just because it happens to be there.
Okay, lovely. Hope that was helpful. Next question is for Dr. Taggart. So I have very sensitive skin and have to be very careful with makeup and skincare products. Would I be suitable for ThermaVein still, or could it irritate my skin?
So anyone can have ThermaVein treatments. Some people are more sensitive to it than others. It's difficult to predict that. So usually on the first treatment that I would perform, I would be very cautious and gentle. Sometimes at your consultation, I would do a test area, for instance, behind your ear where it's not so visible, just to see how you react to the treatment. And then we can assess that when you come back. But yes, you certainly could react to the treatment, and the secret is not to over-treat you at the start. So we would proceed with caution.
Okay, lovely, thank you. Next question. I have patches of veins that look like bruises on my legs. Are these varicose veins?
Not sure. So if you can feel them and they're bumpy, they can sometimes be described as varicose veins, but occasionally you can have a type of thread vein appearing near a varicose vein that looks like that. I'd need to see that before being able to tell you one way or the other.
Okay. Next question is from Judy, and Judy says, are there any risks, i.e. is there a greater risk of blood clots from treatment, and also do the veins come back?
So risk, yes. The only real risk that I worry about is a deep vein thrombosis, and that can occur after any operation. I quote people a risk normally of around 1 per 1,000 procedures, which is pretty low. And just to put that in perspective, having an appendicectomy carries a risk of 1 per 100 operations. Having a baby is about 1 per 100. Breaking your leg skiing can be as high as 1 in 10. So I would call those pretty risky procedures. From a varicose vein point of view, I nearly always give you a blood thinner called Clexane on the day of the procedure, and we're very particular about you being up and walking. So if you weren't up and walking afterwards, we'd like you to give us a call and we get you back straight away. But you might also say, what's my risk of getting a DVT just out of the blue for whatever reason? And it's actually surprisingly 1 in 1,000 people per year get a DVT. It doesn't have to be any obvious reason or cause. So there is a slight risk of a DVT. I try my best to make sure that doesn't happen. And with regards to veins coming back, because I scan you in clinic, I'm pretty certain which vein is causing the trouble. So when I laser that, technically that's not going to come back. But what people are really asking me is, if I have one vein done, what's the likelihood of me coming back for another procedure? So I quote you a risk of about 1% of people within a year come back to me to show me something. It's normally a little vein that's popped up somewhere, and normally I can treat that with just an injection. About 10% of people after about 10 years come back with a new varicose vein, and it's almost always the other leg. So if you have veins, you're a little bit more likely to get them again. But one of the nicest advantages of whether it's laser treatment or microwave treatment or radio frequency treatment is the risk of recurrence is pretty tiny. And I think that's partly because you're using an ultrasound and making sure you get the correct vein at the beginning. And that seems to sort the problem out.
Thank you. Very comprehensive answer there. It was helpful, Judy. Next question. Would you recommend EVLT treatment before a hip operation or after?
That also depends. So if you're not able to walk because your hip is knackered, I would say you probably should get that fixed first before having any varicose vein treatment. If, however, it's a chronic problem and your hip is a bit sore and it's giving you a little bit of swelling in your leg or a bit of discomfort from the vein, I think it's entirely reasonable to have the vein treated first so that you enter your hip operation essentially in good condition.
Okay, thank you very much. Next question is from Michelle. Michelle asks, I've got a small vein visible on the surface of her skin on the outside of her leg, just around from the calf. After an hour sitting at the desk or driving, it's really painful. The pain is right where the vein is, and she sometimes presses it to relieve the pain. It's not lumpy or large, which is why she wasn't sure if it was a varicose vein. Should she get it treated?
That also depends. There are loads of different reasons why you can get ache in your leg. Varicose veins nearly always give you more trouble as the day progresses. So in general, if you're lying flat in bed, there's no great gravity issue. And so normally with veins, you wake up in the morning and your legs are feeling fine. As the day progresses, it often gets a bit worse. If you do specific things like sitting in a chair or driving a car, it often makes it a bit more uncomfortable. The problem is sometimes you can get problems with back trouble, giving you referred pain down your leg, or even joint pain. And although veins are relatively common, and you can certainly see them, sometimes you can confuse a muscle or a joint problem with a vein problem. So I nearly always, when I see you, make sure that I can see a varicose vein nearby. And in general, people don't get two things going on at the same time. So if you happen to have a lumpy vein and it's painful, it's almost certainly the vein. But if it's not lumpy, that can be a little bit, you need to be a little bit careful about having your vein treated without being certain that that's going to sort out your problem.
Okay, hope that was helpful, Michelle. Next question is from Elizabeth, and she asks, are there any side effects to having laser treatment?
So when I laser people, I try my best to tell them that it's not walk in, walk out and back to normal type surgery or lunchtime surgery. So I would say if you talk about side effects, it depends how you define side effects. So every operation has a set number of things that happen afterwards. So I'm expecting it to be a little uncomfortable, but not that bad. I'm expecting it to be bruised. Sometimes it's quite dramatic, the bruising, but that goes away pretty quickly. And when I talk to people about side effects, what I'm really saying are things that are a little bit out of the ordinary. So you expect a bit of discomfort, bruising, takes about 6 weeks to look okay. Normally, if it's itchy skin or problems with your skin, that goes away really, really quickly. But occasionally people have a little bit of discomfort. They can have a little numb patch where perhaps the laser has irritated a small skin nerve, or even the most common thing is where I've injected a little bit of local anesthetic too close to a skin nerve and it stops working for a while. They normally resolve themselves. So in terms of side effects, yeah, there's loads of side effects. But what I think most people want to know is 6 weeks after the operation, have I essentially forgotten about everything? And the vast majority of people are back to normal, not thinking about their legs.
That's very lovely. I hope that was helpful, Elizabeth. Next person's asking about pricing, which we've got displayed on the screen there. And if you would like a quote, then please do call our private patient team. And that number will be on the next slide when we get to it. Laura has come back with another question, and she asked, is there a best time of year to have treatment, i.e. do you have to wear support stockings for some time after?
I don't bother with support stockings. I think they're just beyond miserable. Most people can barely get them on or off, and they very rarely fit properly. So I think they're a nice way of fobbing someone out of a consultation. Well, I don't do that because I know virtually nobody wears them. With regards to good time of the year or bad time of the year, in an ideal situation, you'd have your veins done in January when it's nice and chilly, so you don't get worried about having a bandage on for a few days. And by the time it gets warm, everything is all fine. However, for the vast majority of people, they forget about their legs in January, February, and it's normally when it starts to get warm again, they suddenly realize that their veins are starting to give them grief again. So the commonest, the busiest time of year is actually summertime for veins, not because people don't like the look, but because when it gets warm, your veins dilate, and if you're having any itching, soreness, or pain, it gets much worse around that time. So there isn't actually any ideal time, but I do think you more or less have a 3-week period where you wouldn't show your legs because they look a bit grim. So that might interfere with holidays, etc. So ideal in the winter time, but that's not the way it works in reality.
Lovely, thank you. Next question is from Nikki, and she asks, do you have a scan for lighter thread veins on your legs, or is it assessed visually only?
If they are obviously small thread veins, we only need to visually assess them. But if there's any doubt whether there is underlying larger varicose veins, I would always refer to Mr. Sweeney for a scan. But it's usually fairly obvious to differentiate between the two. But if there is any doubt, then we do arrange scans.
Okay, lovely, thank you very much. Next question is from Beer, and they ask, I had a droplet test done. Pressure on one leg is very low. Is that a problem with veins?
Yeah, so I think you're talking about a Doppler test there, and sometimes you can do a test where you put a blood pressure cuff around your ankle, and rather like when you put the blood pressure cuff on your arm, and you kind of measure how much pressure is getting down there. So if the pressure is low, it's sometimes a sign that the blood is not getting down your leg, so it's not usually a problem with your veins. It's also a test that's not very accurate. I don't do it because it sometimes causes more anxiety and trouble than it solves. So it depends. If you're if there's not a great deal of blood going down your leg for whatever reason, normally you can't walk very far because you get a lot of pain and ache in your leg. And the Doppler test is a bit irrelevant. You need a slightly more detailed scan of your arteries. So the answer to your question is, if the pressure's low, it's not to do with your veins. It's to do with your artery, which is the one bringing the blood down to your foot.
Yeah, lovely. I hope that was helpful, Bear. Next question is from Lorraine, and she asks, how do you know which treatment you need if you have a few different issues?
Well, nearly always the varicose vein bits are bumpy, lumpy, and a bit sore. And they are often associated with a load of with thread veins as well. So nearly always, if you see me first, I will get rid of the ache, pain, discomfort, and get your leg back to looking smooth again. And then Dr. Taggart would sort out the smaller veins to make everything look perfect. So if you can't feel anything and they're just on the surface, that's more likely to be a thread vein treatment. If you have bumpy things, then that's going to be a bit more likely to be a varicose vein operation.
Okay, lovely. And just one more question around pressure stockings, which I think we've probably already covered in terms of what our consultants would recommend.
We'll answer that one actually.
Yeah.
So if you wear a compression stocking that's fitted absolutely perfectly, it's probably going to relieve your symptoms. So sometimes people come to me with varicose veins and back pains and a few joint pains, and I'm not entirely sure which part of that pain is caused by their veins. So I usually say, could you wear a pair of flight socks, for example, or if you've got a decently measured pair of pressure stockings, could you wear them just for a couple of days to see if they relieve your symptoms? So if they relieve your symptoms, then I'm much happier that the reason for the pain is venous. Now, the problem is that I find that when people are measured for a compression stocking, the whole idea is that it's compressing, but actually putting them on can be very difficult. If you have a bit of arthritis in your hand, you will definitely not be able to pull them on. And if you have a dodgy back or even a big beer belly, it's very difficult to get the whole things on. So it sometimes takes you half an hour to get them on in the morning and another half an hour to take them off. And sometimes they're a bit too tight. So that I've found them not very comfortable. And the problem is that if you're prescribed those in the NHS, it kind of finishes the consultation essentially, because there's a treatment being offered to you, which is a stocking, and it's up to yourself whether you wear them or not. I find that most people don't wear stockings because they find them totally miserable. But I occasionally see people who've worn stockings for decades and think they work wonderfully well. But that's not far away. That's not the majority of people. Most people find them miserable.
Okay, I think that's a definitive answer on those then. So that's our last question. So thanks again for your questions and for being part of this evening's session. If you wouldn't mind just moving on to the next slide, please. Thank you. That's great. So as a thank you for attending, we're pleased to offer 50% off the value of your initial consultation using the code there on the screen. You may also get a call back from your dedicated private patient advisor, an email with a recording of this session, treatment information and loyalty reward points, and updates on future events and health news. And we really appreciate it if you could take a moment to complete the short survey that will appear at the end of this session, as it really helps us to improve and tailor future webinars to your needs. If you'd like to speak with somebody to book your consultation, our private patient team is available until 8:30 this evening and from 8 AM to 6 PM Monday to Friday, and you'll find their contact number on your screen just there. So we've got some other webinars coming up over the next couple of months on a range of topics, including plastic and cosmetic surgery, heartburn and acid reflux, hip replacement surgery, and treatment for knee osteoarthritis. And you can sign up for those on our website. So finally, on behalf of Mr. Sweeney and Dr. Taggart and all of us here at Benenden Hospital, thank you very much for joining us this evening, and we hope to hear from you very soon.